Assalamu alaikum, my name is Dr. Imtiaz-Umer. I'm a GP in Derby. I'm going to be going through the top 5 tips for Ramadan under lockdown. Tip 1. Stay home, save lives. Ramadan is a particularly special time of year for us. We feel the blessings all around us, and particularly more so when we gather in our groups of families and friends. This happens during iftar and tarawih. Unfortunately, during the current coronavirus pandemic, we have to strictly adhere to government advice and make sure that we're staying at home in order to help save lives. We know that the coronavirus pandemic is disproportionately affecting Black and Asian communities. We all know family or friends who have been affected by the coronavirus, and it becomes more important for us to be really strict in order to stay home and save lives by not going out and not partaking in social activities. Some things that you can do to help social distancing include planning your meals in advance so that you can avoid repeated trips to the shops. You can also make sure that you're keeping your iftar meals simple and nutritious. Tarawih and itikaf can be performed within the home, and there are lots of different ways in order to make sure that you complete the full Quran during this blessed month. Ultimately, Muslims should remember that this month is the one in which we try and restore our connection to Allah, the community, and our true selves. The inability to perform certain acts of worship does not negate any benefit that you can obtain from this month by staying at home. Allah says in the Quran, He is with you wherever you are. Tip 2. Seek the advice of your GP for non-coronavirus illnesses. We are hearing on a daily basis about coronavirus illnesses. We also know that non-coronavirus illnesses are still continuing to happen. Heart attacks are still happening, cancer will still need to be diagnosed, and kids will still become sick with other medical problems. We need to underline to you how important it is that you seek your GP's advice, because we're worried that there's been an unusual reduction in non-coronavirus medical problems. It's really important for you to know that general practice and hospitals are open. GPs are still seeing patients if they need to be seen. If you're worried that you have an urgent or a serious medical problem that needs attention, please contact us for support. Tip 3. If you are older or have an underlying health condition, do what you would normally do during the month of Ramadan. If since last Ramadan you have developed a new medical condition and are unsure as to what you should be doing, seek the advice of your GP. An alternative source of information would be the British Islamic Medical Association. On their website, they have a wealth of information and resources regarding which conditions should mean that you either fast or abstain from fasting. Tip 4. Even if you do become unwell with COVID-19, you may still be able to fast. Currently, there is no guidance or evidence to show that being unwell with COVID-19 prevents you being able to fast at all. Your ability to fast will depend on how you are feeling. As with any other illness, Allah subhanahu wa ta'ala has given us dispensation to abstain or break a fast if we feel physically unwell to continue. Utilize these blessings from Allah and abstain from fasting until you become physically well to continue to do so. Tip 5. Promote mental and psychosocial well-being for yourself and your community. Despite the different execution of this month of Ramadan and the practices that we would normally undertake, it's really important to help reassure that we can still reflect, improve, pray, share and care, all from a healthy distance. Ensuring that our family, friends and elders are still engaged despite the social distancing that needs to be considered, we can consider alternate and digital platforms for interaction. Offering special prayers for the sick alongside messages of hope and comfort are methods that we observe during the month of Ramadan, and we can also include maintaining public health at the same time. Think about hosting or attending a virtual iftar.